Good afternoon, everyone, and welcome to today's webinar focused on supporting mental health for dairy processing employees. I'm Rebecca Sweeney, and I serve as Senior Director of the Wisconsin Cheesemakers Association Programs and Policy. So that has me doing your federal and state lobbying, but I love working with our HR leaders and our Workforce and Education Committee, and also the folks who are working with us in employee health and safety in our health and safety group. And that's really the focus today. I'll be your host for the next hour. This session is part of WCMA's ongoing free member webinar series, and we're proud to offer this particular conversation during Mental Health Awareness Month. May is a time when a lot of organizations across the country are focused on breaking stigma, raising awareness, and improving access to mental health support. And as you all know, I don't have to tell you, the work done in dairy processing is demanding, physically, mentally, emotionally. You have long shifts and production pressures, and sort of the 24/7 nature of our industry does take a toll. Today's webinar is designed to help you as employers give practical and actionable tools to support your employees' mental health. That is whether you have a dedicated HR department, as some of you do, or you happen to be wearing multiple hats and you are graphic design as well as HR, right? We appreciate the focus that you have on employee wellness, and we're here to support you in that effort. We're honored to be joined today by Dr. Kate McCoy, who leads occupational health and safety efforts at the Wisconsin Department of Health Services. Dr. McCoy has worked with us in the past, particularly as we first looked at the onset of the H5N1 virus in dairy herds and what you all could be doing to support your employees, particularly in the pre-pasteurization area. She is an engaging sort of speaker and really dedicated to the work that she does. I love working with her, and I feel really fortunate that she could give us some of her time and expertise today. Dr. McCoy has worked extensively with agricultural and food processing employers to promote worker wellness and create safer, more supportive workplace cultures. Before we dive in with Dr. McCoy, a few quick housekeeping notes for all of you. First, all attendees are currently muted to keep our audio clear. Please use the chat box at any time to submit your questions. We're going to be pausing a few times throughout today's program for discussion. We've also reserved time at the very end to address your questions. Please know that this webinar is being recorded, and you will receive a follow-up email with the recording link and any of the resources that Dr. McCoy references during her presentation. If you need any technical help during today's session, just message me or my colleague Greta Senhen in the chat, and we will be happy to assist you. Again, this topic is really timely. It's important. It's relevant to everyone on this call, and we're really glad to have you here. It's now time for me to turn things over to Dr. Kate McCoy. Thank you so much for being with us today, Doctor.
Thank you so much, Rebecca. Let me get my slides started. Are you seeing the slide deck?
It looks great. Thank you so much.
Great. Thank you so much. What a wonderful introduction. Thank you so much. And I will just say, I love working with this group and with you, Rebecca. It's so wonderful to be engaged with a group of folks who are so committed to the well-being of their workforce. And as you said, this is such an important topic. Just a little bit about me to kind of set the stage. I'm not a mental health clinician, and the doctor part of my name you'll see there is PhD, not MD. So we come at occupational health and safety from a public health perspective within our state Department of Health. And so what we offer is a lot of information, prevention materials, things like that. So that's the angle that I'm going to be coming forward with today. And I do have a background in mental health policy from previous jobs and have done some of the trainings that we'll talk about, but just want folks to know, if there are questions that are for clinicians, then I will let you know and take a pass on those. But there's so much that we can talk about as just sort of regular folks thinking about these questions and looking at what resources are out there. So there are lots and lots of things that could affect people's mental health. What we're going to focus on today is specifically those parts of mental health that are related to the workplace and how can the workplace sometimes contribute to mental health problems and stressors, and what can we do to make that better and make a positive workplace. So we'll look sort of first at what are the job-related mental health risk factors generally, and why do they matter? And then I'll talk a little bit about what we know about dairy processing and manufacturing and food processing potential stressors. And then we'll move on to solutions in terms of broader workplace practices and then some very specific mental health resources. And if you have questions as we're going along, please put those in the chat and we'll have folks help make sure that I see that. Okay, so just a little bit of information about work and stress. Very common. Workplace stress is very common. Burnout is very common. Feeling emotionally drained is very common, but it does not need to be the case. So these are some statistics from Mental Health America, which is a great organization that I'll mention a few different resources from. But 4 in 5 workers report that workplace stress affects their relationships within and outside of work. The same number of workers can feel emotionally drained from their work as an early sign of burnout. And then 1 in 4 workers are experiencing the more severe signs of burnout, and including all of those things listed there. And we'll talk a little bit more about chronic workplace stress and what that can lead to. And this is from our Department of Health Services dashboard on suicide. So my colleagues who work specifically on suicide create this to look at what are some of the main contributions to suicide risks that were cited in death records. And so this is from Wisconsin. And the data is a little bit lagged because of how long it takes for death records to be fully reviewed, et cetera. But you see here that we have in the middle financial problems and job or employment problems together are about, almost 20% of the reasons cited as contributors to suicide. And we'll also talk a little bit later about the physical health problems, which is at 28.7%, that can also sometimes be related to working conditions. So what job problems might contribute to something that's such a severe mental health problem that people are suicidal? Any thoughts or guesses?
There's no wrong answers here, and you can either unmute or you can put something in the chat. But we love to get a little interactive. Oh, I love it. Already in the chat, we have friends who are offering ideas. One says maybe you're overworked. Another person says maybe in the workplace you're facing bullying. Another person says lack of pay or financial stress. Another, lack of employees resulting in doing jobs for multiple people. Coworker treatment, terrible boss, terrible leadership. So this is not, I can't say that this is a mystery to anyone why people might feel stress in their workplace. Another thought on this is the shift or schedule that you're on. PTO, no time to use it, a lack of resources. So we've got some themes here that it can be coworkers or bosses that might create some stress for an individual. It could be the amount of work that they have to do and whether or not they're able to take good time off, whether they're being recognized for their effort. Maybe there's financial stress. So Dr. McCoy, a lot of thoughts on this.
Fantastic. And yes, the no wrong answer was not just a nice thing to say. It was 100% accurate. Those are very much right on target. And it's part of the reason that I put that out there for folks is because people do know this. You've been in that situation, or your partner has, or your friends have, or your employees have, and you're aware of it. So here are some of the main workplace psychosocial stressors, is kind of one of the technical terms for this. And things that you mentioned. So for instance, having low job security, you're worried that you're going to lose your job. Low pay, low flexibility of time off, low social support in the workplace. When you feel like you have no control or autonomy, like you're just being treated like a machine. When the job has no sense of meaning, you're just going through the motions. When there's a lot of ambivalence about what is it I'm even supposed to be doing, how would I know if I'm doing it right or not? That's extremely anxiety provoking. So low training or poorly defined roles. Add into that if you have a really bad supervisor who's critical, that's a terrible situation to be in. So then conversely, if you have a micromanaging boss, if you have, like you said, a workload and hours that are not sustainable, a pace of work that's not sustainable, or any kind of abusive, toxic, or unfair work environment. We do know, someone said workplace bullying. We do know that bullying, even among adults, has significant ripple effects in mental and physical health. It affects your heart health as well. It affects your ability to concentrate and focus. So yes, all correct answers, excellent responses. And just quickly, here are some of the ways that a stressful work environment has many different cascading effects that converge to put a lot of stress on people's mental health. So if you are in a bad work environment that creates undue stress over time, it's affecting your habits. So reduced mental health and poor health behaviors, your sleep, exercise, alcohol. Those are things that really can have big cascading effects, sleep in particular. On the other side of the slide there, if you have an unsafe work environment or unsustainable in ways that are not conducive to health, that affects people's physical health and in many different ways. And oftentimes people are working with a lot of pain, and chronic pain in and of itself is a risk factor for suicide. That doesn't mean that everybody who experiences chronic pain is suicidal, but it's something that does increase people's risk. And so then those converge with the other mental and emotional strains that we talked about, creates a real risk for psychological injury, depression, anxiety, burnout, and suicidality. So, hopefully it's pretty clear, why we care about those things generally, but why does poor mental health matter for business? And just put in the chat a few different reasons why it matters, because this will help you if you need to make the case too to others in your organization or to your employees about why get involved in this from a business perspective.
Again, what a great crew, immediate responses to your question of why this matters. We have a couple of thoughts, quality of work, quality of outcomes, productivity, engagement, poor or good performance, turnover, engagement equals quality. Someone says, you can affect your coworkers' mood as well. So a lot of good thoughts there, a lot of them centered really around how you're able to perform at work and the impact that you have on others in your workplace.
Absolutely, definitely. And so to add to those outstanding answers, increased absenteeism, also related to productivity. When people are exhausted, sleepy, they haven't been sleeping well, or they're distracted, they're foggy headed, they're depressed, they're not on their game. They have greater injury risks because of that as well. And those things can compound into higher health costs for your organization. You mentioned higher turnover, you mentioned low morale, and reputational risks. If a lot of folks in your organization feel like it has a toxic work environment or just is not a great place to work, that can reflect poorly on the organization overall. So let's talk a little bit about some of the things that we know about risks that might be relevant to dairy processing workers, and then it'd be great for you all to fill in the gaps in what we have from our available information. So on my team, one of our epidemiologists, Dr. Paul Cresswell, has recently completed an analysis of suicide rates in Wisconsin by industry and occupation. And so this is showing the occupations with the highest suicide rates. And what I did here is I just put in these little boxes some of the jobs. This isn't industry, manufacturing, food processing would be the industry. But within that, what are some of the jobs that are likely relevant to your workforce. So production occupations, right off the bat, installation, maintenance, and repair folks, guessing that you have some machine technician type folks in your industry.
These are
Some folks
all
who,
right on, Dr.
okay,
McCoy. All of
great,
these.
great.
You know, sometimes we hear about farmer mental health
Yes,
within our world, right? But to see that so many of these occupations that are in dairy processing facilities are, you know, we have very serious mental health matters, even more prevalent, is really eye-opening. Thank you.
absolutely. And yes, I mean, you see farming there. It's interesting. Farming is generally known as fairly high risk, but is not showing up quite as high in our data, which is great. Um, but it, might be too because people are listing their other primary occupation and the farm is their secondary occupation kind of thing. But yes, you see your workers right there, right near the top. And so then if we dig down a little deeper into what's included in production workers, you see luckily food processing workers as a subcategory of production occupations um, are near the bottom of that very high category. So you're not the highest risk of production workers, but still definitely worth paying attention to. And it's great that you all are here today to talk about what are some of the risks to these workers. So generally, when we look at manufacturing and mental health, there has been some good work done on manufacturing and mental health risks. It is generally considered a pretty high risk sector because of job stress, fear of job loss, isolation, physical health, along with other things. And then more broadly, if there's some work just on people's work setting, and 69% or nearly 77 in 10 employees who worked on their feet in a set location had negative work health scores. So that's them talking about the workplace health setting as well as how they feel about work and how they feel about their mental health at work. And that's higher than, as you would probably imagine, people who are remote desk workers, for instance. We had some worker listening sessions that we commissioned through the University of Wisconsin, and there were some really heart-wrenching but illustrative quotes from a lot of different manufacturing workers, including a few in food processing. And I'll just pull out a few here that are relevant. So we heard a lot about line speeds. We heard a lot about understaffing and long hours and stress. So here was just an example of a quote from a food processing worker who said, what is happening is a lot of people are getting hurt or hurting their arms, their shoulders, because there are lots of heavy things in the machines. The packing machines used to run at 65, are now running 80 to 85. It's too fast. So that's physical health, but these are the exact kind of quotes that then would lead people to talk about stress, mental health, burnout as well. And similarly, this was a quality control worker who was talking about starting on a certain number of machines, and that number just kept going up and up. And he said, so there was a moment I couldn't do it anymore. I had to work 7 days, 12 hours per night, and it comes a moment in which you feel too much stress. And so again, those working conditions really have a very direct impact on people's lives. So what concerns do you have for your workforce? We've talked about some of the things that exist in kind of what's out there in the literature and what we've heard in our listening sessions. Is there anything that we haven't talked about that you want to bring up as potential concerns?
I think a source of a lot of concern for people is a feeling of instability right now. I think a lot of business owners feel that instability sort of just in the world and also in the dairy marketplace. And at the same time, I think that people individually have a bit more instability. What will the future hold right now? Because we're in a moment of change. And that's what we're hearing in the chat here too. We had someone share, you know, the pace of change and some folks reacting to that as well. So I think that's definitely a snapshot issue for us right now.
Absolutely. So relatable. I'm coming from the public sector and our work is actually federally funded, and the future of that is very uncertain. So having to live these things, alongside you, uncertainty and, fear about the future are really difficult things to deal with. And so I think, acknowledging those realities, talking to folks about what you do know, what you don't know, what you can say right now, what you have to hold off on, offering support to one another, and just being as steady as you can in the presence of other things that are in flux. All of those things make a big difference, but very, very relatable. So, I started off talking about the risks, but now we're going to start to pivot more to what are some of the things that can make for a healthier workplace. And there's lots that is helpful. So just to point out that good work can be a very strong protective factor for physical and mental health. It's one of the reasons why it's so devastating when people lose a job, or it can be devastating, because along with financial security, you can lose a number of other things. You can lose your friends, your social interactions, your sense of meaning, etc. So I already kind of gave away some of those. What good things do we get from a good job or workplace? Any other things that people want to add besides what I mentioned? Salary, colleagues.
Yeah. Feel free to put those in the chat. I can tell you, I'm really fortunate to have a good workplace. And I think number one for me is a sense of belonging. I
Yeah.
feel like I am known by people, and because they have big hearts, generally liked, right? Got a coworker who just put in the chat, community.
Yes.
Other folks in the chat saying a sense of accomplishment. That's
Excellent.
great. Workplace friends. So I think definitely that sense of community, knowledgeable and understanding leadership. So you can find mentorship and guides, both professionally and personally. You can feel like you're making a positive impact. These are all great contributions in the chat, everybody. I love the engagement today.
Absolutely. Yes. And so, keep these in mind. These are some of the themes that will be coming through on some of the workplace practices. But hopefully this helps you start to remember, like, oh yeah, a sense of belonging. How can you help to continue to create a sense of belonging in times of uncertainty? We can sort of pull these different elements together as we're moving through this conversation. So what helps? Again, building on what we were talking about before as some of the risk factors, some of the foundational work practices are some of the solutions. So, you don't want to do a lot of work to, set up great EAP programs if, you don't have these foundational work practices in place necessarily, because it's just like pouring water into a sieve. If you can, you want to kind of get the foundation in order in terms of, do what you can in terms of adequate staffing and training, safety culture, reasonable and sustainable demands, high quality managers. Because if you can have a workplace where people can work safely, sustainably, and weather some of the blips of, whoops, all of a sudden I have to take my parents or my kids to the doctor or pick someone up, or I'm sick, or things like that, that goes a very long ways towards reducing people's sense of stress in the workplace. So just, do a check on some of those things that aren't maybe normally considered mental health interventions, but are really, really imperative for helping people feel good at their workplace. And then there are lots of different good management practices that could be highlighted, but a few that are related to sense of belonging, mattering at work, and creating opportunities for growth are things like offering training and professional development, again, so people don't feel stuck or bored or overlooked. If you can have pathways for advancement, recognizing people's skills and giving them a way forward. If you can incorporate mentorship, if you can provide relevant strengths-based feedback, that means a lot to people. Sometimes putting that feedback in writing, even if it's just in a note, that means a lot to people. Anything you can do to create meaningful opportunities for employee input, are great. And meaningful is key here. I think we all get asked a lot, fill out a survey or something like that. But really engaging the workforce where you can about, is this working for you? Are there things that we could tweak to make the workplace a little better? That really, really boosts engagement a lot. Anything you can do to create spaces for connection, whether that's break room, having breaks, having spaces, literal spaces for connection, having opportunities for activities, allowing people to post information about community events, letting people bring in food from their culture, really anything that can create those spaces for connection is helpful. And then respecting boundaries between work and non-work time. This is often overlooked, but it's important right now. We're all so connected through social media, through our cell phones, through all kinds of things. But it can be very, very stressful for people when their boss can text them at any time, day or night, for instance. It's really hard to not feel like you're on the clock or on the hook. So just checking that space and allowing people to not worry about that is really helpful. Of course, we're talking about mental health, so ability to take care of oneself. So sick leave, not just offering sick leave, but making sure as a management practice that people know that they can actually use it without that being stigmatized or looked down on. If people need to go beyond their sick leave, or if you don't offer sick leave, what kinds of flexibility can be offered so that people can use flex time. They have to go to a doctor's appointment now, but they can make up that time later. Those things really go a long ways towards people's well-being and their appreciation for their workplace. Obviously, related to that is health coverage, having good health coverage, EAPs we talked about, and make sure that those are options that work for your workforce. So in the literature on workplace mental health, one of the things that's pointed out is, it has to be, a lot of times people who are working long hours, doing shift work, working, off hours, aren't going to be able to go in to see a mental health provider because their schedules don't line up, even if they have the coverage and even if they have the sick leave. And so making sure that there are many different ways that people can access information, including virtual or on-demand options. And there are lots and lots of different tools that are out there to help you and your organization have some of these conversations and do a little informal assessment and check-in. So here's one set of tools that's from the Surgeon General's Framework for Workplace Mental Health and Wellbeing. That is a great framework, and this is just an example of some of the discussion questions that they have there around some of the topics we've been mentioning. And then similarly, Mental Health America, which I referenced earlier, has these little articles on different questions like, what questions should we ask our benefits broker or EAP provider? So they really delve into some of these things that I'm just starting to highlight here. And they have more tiles than just what's displayed on the screen. So I really recommend looking at their materials. So those are some of the practices generally, more specific tools that you can look into. OSHA actually has a whole set of materials on workplace stress and well-being, including these good headspace tools. So, OSHA generally is regulatory and compliance-based, but they also have all of these materials that have nothing to do with the compliance side of their work. They're just sort of free voluntary best practices materials that you can pick up and use. So here is information for instance, frontline supervisors, which is very practical and kind of helps you understand, how do I approach these topics with my employees? What can I say to help people? Things like that. And they have additional tools on there as well. Here are just a couple of examples of some relevant flyers that you can put up in break rooms or restrooms or around the workspace. And I chose a few that are also available in Spanish at least. This signs and symptoms of stress is, I think, from UMass, Upper Midwest Agricultural Safety and Health Center, and it's a two-sided flyer. You're just seeing the front. And then the 988 Lifeline flyer is also a great one of several suicide and crisis lines that are available. So that's just a real easy thing. If you do nothing else, but you just make people aware of these resources, that's confidential. They can just put that information into their phone. They don't have to talk to anybody about it if they don't want to, but it's information you're making available. There are also some fantastic specialized trainings for those of you who want to delve into this topic more, or even maybe bring some trainings into the workplace. So mental health first aid is a great training that, like the name implies, first aid. Regular first aid is for those of us who are not doctors and nurses to just learn what do we need to know in an emergency situation to help out someone who's bleeding or has fallen or something like that. Mental health first aid is the equivalent for what are those of us who are not mental health practitioners, what do we need to know to be able to help somebody who might be in a mental health crisis or might be approaching that situation. Just give us some basic skills. And so there are different levels of it you can take. I've taken the general mental health first aid course. You can take a very short 8-hour course, and it's a great training. And as I was putting these slides together, I stumbled across for the first time the fact that there is a mental health first aid at work for manufacturing set of trainings, which is phenomenal. And so they have several different course options that can be done by whole teams or by individual supervisors, etc. I did not see any trainings currently scheduled in Wisconsin. There are regular mental health first aid trainings that anyone can join, but if you wanted to bring someone to your workplace to administer the mental health first aid at work for manufacturing modules, it looks like that option is still available. So I would, based on what I know from mental health first aid, I would highly recommend it. And then another option for sort of short general trainings for anyone to prepare folks for sort of like the first aid approach is QPR, online gatekeeper training. This is, like it says here, I put the information, just a 60-minute training where people can get trained for $30 at this point, it looks like. And just a real quick overview of what are the signs and symptoms of, in this case, suicidality, and what a non-clinician can do and say to somebody to help them get help and recognize those situations. And then there's also this suicide risk screening tool, which has been used in many different settings and has been studied extensively, the Columbia Suicide Severity Risk Scale. It has been translated into many, many languages, and I put the link there so that it can be made available. And it's another resource where there are free short online training modules available in multiple languages as well. So that's something that you could take a short training in. You could offer it to employees. You could do it as a team. If there are, concerns that we need to have this information to be able to recognize serious concerns in your workplace, or if people just have that, just want to know those skills, beyond the workplace as well. So that's about seeing when somebody is in serious trouble and making sure that they get to help immediately. So those are some of sort of the tools and trainings that are out there. If you need help finding mental health services and mental health providers, or want to make sure that your employees know how to find those services, one place you can do that is on the Department of Health Services website, and I just circled here where you can open up the Community Mental Health Service Providers Directory, and that is updated regularly, so you can find what's out there. There are a lot of services that are listed. It's long been the case that there aren't enough mental health service providers for the demand. And some parts of the state are a little better than others, but it's not uncommon for there to be waiting lists sometimes. So It's good for people to get hooked up with services as soon as they can, rather than waiting, because that waiting period might be something that they have to sit through. But information is there. Also, if you weren't aware of it, DATCAP has the Farmer Wellness Center, and through that, they make a lot of mental health resources available. So generally, those are for farmers, but they're also for rural folks. So some of these are very specific to farmers. Some of them are more open to other communities. So I just put a little screenshot there of some of those materials, and they have others as well. They have podcasts and links to many different resources. So I recommend checking that out.
I'll jump in here for a second, Dr. McCoy, just to say that Karen Endress, who runs the Wisconsin Farm Center Mental Health Services, is actually on with us today and in the chat.
Oh,
She
Karen,
just wanted
hi.
to note, she wanted to know everybody unite. It's a team effort. She wanted to promote that there is, for folks on the line who are in Wisconsin, adult mental health first aid program for the agricultural community coming up June 17th and June 19th. And so that link to that resource for, again, the Wisconsin-based folks on this webinar will be shared in the follow-up.
Oh, wonderful. Thank you. Karen, I'm so glad you're on. Karen and I have collaborated on a dairy worker mental health project. Anything else that you want to highlight, Karen? That's the end of the resources. And I was going to go into discussion and questions.
No, Kate, I think you've highlighted a lot and really appreciate it. Just even myself participating in every day, but farms are also types of manufacturing facilities, right? So I appreciate the opportunity to hear you and get some of these resources. But as Rebecca said, anyone in Wisconsin who's interested in getting that training, Joy Kirkpatrick is doing that mental health first aid on Zoom. So it will be a virtual, but a great opportunity to dip your toes in and understand about that training in case you want to offer it to others in your businesses.
Excellent. Thank you. That's great to know that there's a manufacturer, an ag specific version. Wonderful. Yeah, so I'll open it up. I have a few discussion questions here, but really I'm here to answer any questions that I can or engage you with conversations.
So we
that
do
might
have some questions that were pre-submitted, but I would love to hear from our members too, because this is also an opportunity for WCMA to evaluate whether we should be offering more to all of you on a regular basis. Can anybody in the chat kind of let us know, are you experiencing folks in your facilities that are displaying signs of mental health issues or increased prevalence of stressors? And is this a thing that's on your mind frequently? We're getting more questions in the chat than feedback on this. I think it's true that people are experiencing this, and they have for years and years. And there are moments that are more stressful than others and can trigger more mental health issues than others. So I think we'll just transition into the questions. The first one that we have is actually from the chat. Have you seen employers provide access to different mental health benefits, such as therapy or anything like that, provided by employers with their benefits programs?
So yes, there are definitely through things like employee assistance programs. That is one way that employers directly provide that through just health insurance that covers behavioral health. Not all health insurance policies cover behavioral health services. So those are the two things that spring to mind immediately. Am I getting the gist of the question, or was there something else?
I think so. I think absolutely. And I think anecdotally, we can tell you that yes, there are many WCMA members who are choosing certain healthcare providers because they offer better or just any mental health care coverage as well. But critically important is also that ability to take that time. So I appreciate that you had included that in your presentation, because if there's any stigma or sort of annoyance at people taking that time, they're less likely to do it.
Right.
And then what is the benefit of offering that in the first place? Other questions that we're seeing, and this is kind of a gut call, but I think this is what people are dealing with in the real world here. How much do you try to help someone before you involve professionals or start taking action on poor performance? Because, of course, when you do have some mental health care needs, you may also not be at your best in the workplace. So it's that sort of um, reactionary response that an employer might normally have versus sort of the empathy of, I think you might need to talk to someone. How do you make that call? Dr. McCoy, any thoughts on that?
Right. Yes. So, I mean, oh, I'm getting an echo. Oh, there we go. It's better. Great. Thanks. So, you as an employer or the supervisor aren't going to directly involve someone in therapy, right? There's not going to be a situation where I, as a manager, I'm going to bring a therapist in. What I'm going to do is make sure that people have that information available, that they have, access through the resources that we're offering, that we're providing information about how they can access that. And then, what you kind of do first is make sure that kind of that checklist that we were looking at, have we done things that we can do within the workplace to reduce stress, make sure there's not, a toxic environment? Is there somebody who is harassing this person who I don't know about? If there's anything that is in the workplace that you can deal with first that could, remove that stressor, that's one of the first things to consider. And I will bring up, this is where these tools are really great. For instance, let me see if I can share here. These tools for supervisors that I was sharing before, and there's actually many different versions. So you can sort of choose one that you like best. Here's, for instance, the OSHA one. Are you seeing
Yes.
recommendations for supervisors? Okay, great. So I'll show you, this is what it looks like at the top. And again, there's many different versions of this. This is just a sort of a nice one, but it takes you through some of that. So, what can you do? What factors might be making it harder for workers to get their jobs done? That's sort of what we were talking about. If it's something really simple, like the person who is always working right next to them really bothers them for some legitimate or illegitimate reason, you can just switch the placement, take care of that. Showing empathy, directing people to resources, etc. So, very simple workplace interventions. Sometimes it's about minimal scheduling things, right? If they could come in 10 minutes later because they have to, drop off their kids or drop off their, mother at, daily respite care or something like that. Those are things that you can do. And listening compassionately without violating people's boundaries. So sort of open-ended questions, how are you feeling? How's it going? Are you struggling with any new job-related burdens? How can I help? Are there things we can do in the job to make it better and easier? So those are some of the things. If somebody says to you, nope, I'm fine, no issues, then I think you can start to say, like, okay, well, I have noticed, there are some performance issues and we want to work with you on what we can do in terms of performance. But if there are no job related issues, then it's really, we're going to need this performance to improve. And that may or may not mean that the person, has underlying mental health stuff. One of the problems is when people are depressed, it's hard for them to be highly motivated to improve performance. But if you're doing these things and making information available to people and removing the stressors at the workplace that you can, I think you can feel like you're making an effort.
And Dr. McCoy, I think this question is a related, sort of adjacent question. Do you have any advice for how to show care about an employee's mental health without being nosy or maybe even worse, crossing a professional boundary?
Yes. Yeah. I mean, just doing those kinds of check-ins, just not that different than you would with other people, really, right? So checking in, hey, I've noticed things seem a little off recently. I wanted to check in. how are you doing? How is stuff going? And then sometimes people will share things that are going on, and then you can do, some gentle follow-up. I know things have been hard at home lately. Is everything going okay? I know you're dealing with your, so-and-so's health issue, things like that. Is everything going okay? And let people lead, right? Not asking a lot of, in-depth questions, but creating that space so that people can share what they want to share. And share, and then you can also take the opportunity to say, just so you remember, we do have these other resources, or if you ever want to talk, you can, and making that available to people so that they're not cornered, but they have the ability to use that resource if they choose to.
This next question is kind of a more technical one, so if it's not your issue area, we can do some follow-up on it for sure. But there was a probing question about EAPs. Someone said in the chat that they're struggling with traditional EAP utilization. So maybe you pay for it, but nobody's actually calling or using it, right?
Yeah.
Do you have any feelings about comprehensive EAPs? They make a reference to Lyra. Whether that's a better option. Do you have any sort of insight on maximizing utilization of things like an EAP?
I can't speak to anything like a comprehensive EAP or Lyra. I don't know enough about that. What I would say is if nobody's using it, that's the kind of thing where you can do a little general probing in the workplace. You can have an anonymous little survey that you ask people, why have, we've noticed that nobody's using this. Why don't you use it? Well, if they don't know it exists, that's an easy fix. If they, if they feel like they tried it and it's not helpful, then that's something to know about. Okay, it's not meeting people's needs. If there are language barriers, that's another issue. So I think you really need to know more from your workforce about why they're not using it. And I will refer you again to those, the Mental Health America slides. There was one there that is an article on what to know about, what to ask about your EAP. So that might be a good resource for you to look into further.
And this last question it's a tough one. I'll just say that right off the bat. Sensitive topic overall, but what should an employer do if someone either reports to a colleague or to their HR department that they have had suicidal thoughts? What is the next step?
Yeah, so that's where something like knowing these QPR trainings, the suicide screening, the CSSR is really helpful because, for instance, in that CSSR, which I'm not going to share the screen again, but it's in the slide deck, it asks those follow-up questions. So you can say, so the question I'm reading now, but have you wished that you were dead or wished you could go to sleep and not wake up? These are scary questions for us to verbalize, right? But they've done a lot of work on this, that you're not actually planting these questions in people's heads, that people actually are genuinely relieved to be asked these questions. So it's basically, have you thought about suicide? Have you actually had any plan, pretty much, thoughts about killing yourself? And so it's an escalating series of questions, and it really points you towards it. If people answer yes to the questions after those first couple, then you need to get them to help immediately versus recommending that they reach out to somebody. So the getting someone to help immediately might be, that person, you're not letting them just go home at the end of the day. You're saying, the way that you've answered makes me really concerned. I'd really like for one of us to take you into the emergency room now so you can talk to somebody. And hopefully those are not common situations, but there is just, there is a protocol that you can do. So you don't have to worry about making that up, and getting that kind of training and having those tools in your back pocket is really helpful.
So often having the plan already in place makes it easier to navigate really difficult conversations and difficult situations. So it's a good idea, just like we plan for tornado drills or with tornado drills for a natural disaster, just like we have standard operating procedures in place for food safety. we can also have a plan in place for when there is an employee that happens to be in crisis. And I'm so grateful, Dr. McCoy, that you gave us so many resources. Again, many calls in the chat for links to these. All of the materials will be available in a follow-up email. And just in this moment, I made a decision too. I think we'll also be putting these on our employee health and safety landing page with cheesemakers.org. So I want you to look for those available shortly. So I want to just thank you very much. Within the next day or two, we'll have everything out to people so you can begin to use that. And again, I just want to encourage people that if this is a topic that you find value in, that you want to be talking about on a more frequent basis, or you want specific trainings on, please know that at any time we can offer that to you and to your teams. Thank you for engaging. It's a tough topic. Dr. McCoy, I appreciate you walking us through some of the trigger points and the situation that we see for folks in manufacturing right now, and also some very low cost, in some cases, no cost resources, ways that employers can truly be of support. As we close today, I do want to invite everyone to join us next month in June. That's Dairy Month, everyone. And just in time for it, we'll be taking a look at trends in cheese sales. So you'll want to make sure that all of your sales professionals are on the line with us Thursday, June 12th at 1 p.m. Thank you so much for your engagement. Thank you for your time and have a wonderful day.